name is Ravindra Kolhe. I'm a pathologist at Medical College of Georgia, Augusta University. I practice breast and molecular pathology. I'm also the CLIA lab director for molecular diagnostics. And my work overall encompasses of looking at biopsies, doing molecular diagnostics, next generation sequencing, cytogenetics, smaller molecular panels. Tumor mutation burden is identified as a surrogate marker for identifying patients who would respond to immune therapies. It's very difficult to identify new antigens and who would respond. And in the last 2 to 3 years, TMB has emerged as a really good surrogate marker where we could identify these patients who would respond to immunotherapy. And that's one of the major reasons why a lot of these pharma groups are actively involved in identifying a better way to calculate tumor mutation burden. There are two major issues with TMB calculation. One is the size of the panel, and number two, the bioinformatics and standardization of calculation of TMB. And this is where the role of big consortium comes into play for harmonization of these two things. One is we have to come to a consensus that what is the size of the panel which is adequate enough as a surrogate for whole exome sequencing. And second is having a standardized bioinformatics which would calculate the TMB in a more accurate and consistent way across all panels. While working with the QIAseq TMB panel, it's appropriately placed as far as the size is considered. It is nicely in the range of 1.2 megabase, which is a very good surrogate for TMB calculation. And the number two is the bioinformatics and standardization of TMB calculation. And I'm aware of QIAGEN's effort for harmonizations and involvement of QIAGEN in harmonization of TMB calculation with Friends of Cancer Research. And I think that experience will definitely help us, it'll help my lab to validate and calculate tumor mutation burden in the QIAseq TMB panel.
QIAGEN.
Sample to insight.